You may have heard of the chronic obstructive pulmonary disease, or COPD, but what actually is it? It's dangerous, common, and important to diagnose. This video goes into the signs, treatments, lifespan implications, preventions, and much more on COPD so that you can be armed with the proper knowledge. This video is a complete deep dive on COPD, and we are going to get into all aspects of it. Always talk to your doctor for medical treatments and information. What is COPD? Chronic obstructive pulmonary disease is not a single illness, but a group of progressive lung diseases that obstruct airflow from the lungs. The two most common diseases that make up COPD are emphysema and chronic bronchitis. The name itself provides a clear description. Chronic means the condition is long-lasting and persistent, while obstructive means the airways are blocked or narrowed, making it difficult for you to breathe, especially to exhale. This obstruction is often irreversible and gets worse over time. To truly understand what is happening, let's look at the lungs. Imagine them as a highly complex and delicate system. Air travels down the windpipe, or trachea, into two main bronchial tubes, which then branch out into thousands of smaller airways, called bronchioles. At the end of each bronchiole is a cluster of tiny balloon-like air sacs, known as alveoli. In a healthy person, these alveoli are incredibly elastic. When you breathe in, they expand, drawing oxygen from the air into your bloodstream. When you breathe out, they spring back, pushing carbon dioxide out of your body. This intricate system is what allows for the exchange of gases that keeps you alive. In a person with chronic bronchitis, the lining of the bronchial tubes becomes inflamed and swollen. This inflammation causes the glands in the airways to produce an excessive amount of thick, sticky mucus. This mucus further clogs and narrows the already inflamed airways, creating a perfect environment for bacteria to grow. The body's response to this irritation is a persistent, deep cough, which is an attempt to clear the airways. For a diagnosis of chronic bronchitis, this cough must last for at least 3 months a year, for 2 consecutive years. With emphysema, the damage is different but equally serious. The walls of the delicate alveoli are destroyed, and their elasticity is lost. Instead of having millions of tiny, efficient air sacs, the lungs develop larger, less efficient air spaces. This significantly reduces the surface area available for oxygen to enter the bloodstream and for carbon dioxide to be removed. Think of a pristine sponge versus a sponge with large holes burned into it. The sponge with holes cannot hold as much water. Similarly, the damaged lungs cannot perform their primary function as effectively. The consequence of this is that old air gets trapped in the lungs, leaving no room for fresh, oxygen-rich air, a phenomenon known as air trapping. This air trapping is what makes exhaling so difficult. Both of these conditions often occur together and lead to the progressive, debilitating symptoms of COPD. A majority of people with COPD are also managing other chronic conditions, such as heart disease, diabetes, and osteoporosis. This is called comorbidity, and it significantly complicates the management of the disease. Understanding the basic mechanisms of this disease is crucial, because while the damage cannot be reversed, its progression can be slowed and symptoms can be managed. Epidemiology. COPD is a major global health concern, and its impact is far-reaching. According to a large global study, approximately 6% of men and 3% of women worldwide have the condition. Globally, the disease causes over 3 million deaths each year, making it one of the leading causes of death worldwide. In the United States, about 16 million people have been diagnosed with COPD, but medical experts estimate that millions more may have the condition and not know it. The disease is the fourth leading cause of death in the United States, and it is responsible for a significant number of hospitalizations and emergency room visits. The disease affects men more than women, particularly in the past, but the rates among women are now increasing as female smoking rates have increased in recent decades. The disease is most common in people over the age of 65. For example, studies in the United States show that about 22% of people over the age of 75 have a diagnosis of COPD. It also disproportionately affects people in lower income areas and people with lower levels of education, likely due to higher rates of smoking and greater exposure to pollutants. A less common risk factor is a genetic condition called alpha-1 antitrypsin deficiency. The economic burden of COPD is immense, with a total cost in the United States of around $50 billion a year in healthcare expenditures and lost productivity. These numbers highlight that COPD is not just a personal health issue, but a public health crisis that demands attention. Symptoms and signs. The symptoms of COPD are often subtle at first and can be easy to dismiss. Many people mistakenly believe these signs are just a normal part of getting older or a consequence of a lifetime of smoking. This misconception can delay a diagnosis by many years. The disease often progresses so slowly that a person may not even notice the symptoms until the disease is in a more advanced stage. The most common early symptom is a persistent cough that produces mucus. This is a key indicator of chronic bronchitis, where the lining of the bronchial tubes is inflamed. This isn't a simple dry cough. It's a deep, hacking cough, often referred to as a smoker's cough, that just doesn't seem to go away. The cough is typically most severe in the mornings and can be productive, meaning it brings up phlegm or mucus. This mucus can be clear, white, yellow, or even green, and a change in color or thickness can be a sign of a new infection. The cough itself can be a source of embarrassment and social isolation, causing people to avoid social gatherings. Another major symptom is shortness of breath, medically known as dyspnea. This is particularly noticeable during physical activities. The progression of this symptom is a key part of the disease. The medical community often uses a scale to describe this progression. At first, you might only feel breathless during very strenuous activity, like running. Over time, it can progress to feeling short of breath during moderate activity, like climbing a single flight of stairs or walking up a hill. In later stages, even simple routine tasks like getting dressed, showering, or walking across a room can become difficult and leave you gasping for air. This feeling of not being able to catch your breath can be frightening and can cause people to avoid physical activity, which unfortunately leads to a deconditioning of their muscles and makes the symptoms even worse. Wheezing and chest tightness are also common. Wheezing is a high-pitched whistling sound that occurs as you breathe, caused by air moving through narrowed airways. Chest tightness is a sensation of pressure or a feeling of a tight band around the chest, making it feel difficult to take a full, deep breath. Beyond the respiratory symptoms, COPD also causes a range of systemic effects. Many people with the condition experience a significant amount of fatigue and a general lack of energy. This is because their bodies are working so hard just to breathe, consuming a large amount of energy that would otherwise be used for other activities. People with COPD are also more prone to frequent respiratory infections, such as colds, the flu, or pneumonia. The damaged and mucus-filled airways are a perfect breeding ground for germs, and an infection can cause a sudden and dramatic worsening of COPD symptoms, known as a flare-up or exacerbation. In more advanced stages, you might notice other, more alarming signs. Cyanosis, which is a bluish discoloration of the lips or fingernail beds, can occur when there is not enough oxygen in the blood. Unintentional weight loss can also happen, as the body burns a significant amount of calories just to breathe, and people may find it difficult to eat due to shortness of breath. Swelling in the ankles, feet, or legs, known as peripheral edema, can be a sign that the heart is being strained due to the increased pressure in the lungs. Many people think that COPD is just a part of aging, but that is a dangerous myth. It is a treatable condition. Diagnosis and tests. Diagnosing COPD is a crucial step toward managing the disease. It requires a visit to a doctor and a thorough evaluation. The first step is a physical exam and a discussion of your medical history and symptoms. Your doctor will likely ask about your smoking history or exposure to other lung irritants. A key component of the physical exam is listening to your lungs to check for wheezing or other abnormal sounds. The gold standard for diagnosis is a test called spirometry. This is a simple, non-invasive test where you breathe into a mouthpiece connected to a machine called a spirometer. The machine measures two key things: how much air you can breathe out in 1 second, FEV1, and the total amount of air you can exhale, FVC. Your doctor compares your results to the normal values for people of your age, height, and gender. If your FEV1 is significantly reduced compared to your FVC, it is a strong indicator of an obstructive lung disease like COPD. The test is painless and provides critical information. Based on the results of the spirometry test, doctors will often classify the severity of the disease using the GOLD staging system, which ranges from mild to very severe. In addition to spirometry, other tests may be used to confirm the diagnosis and rule out other lung conditions like asthma or heart failure. A chest X-ray or a CT scan can show if you have enlarged lungs or bullae, which are large abnormal air sacs that form in emphysema. They can also reveal signs of pneumonia, lung cancer, or heart disease. A pulse oximetry test uses a small device clipped to your finger to measure the amount of oxygen in your blood. This provides a quick and painless way to check your blood oxygen levels, a key indicator of COPD severity. A reading below 92% is often a sign of low oxygen levels or hypoxia and may require further intervention. For people who develop COPD at a young age or who have never smoked, a blood test for alpha-1 antitrypsin deficiency may be performed. This is a rare genetic condition where the body does not produce enough of a protein that protects the lungs from damage. Finding this deficiency can lead to a specific type of treatment and can also be important for family members to be tested as well. Prevention. The best approach to COPD is to prevent it from ever developing in the first place. given that the vast majority of cases are caused by exposure to lung irritants, the most effective prevention strategies focus on avoiding these triggers. The number one and most critical step is to avoid smoking. Studies show that 90% of all COPD cases are related to smoking. If you currently smoke, quitting is the single most important thing you can do for your health. Studies show that quitting smoking at any age, even after years of smoking, can significantly slow down the progression of COPD, reduce symptoms, and improve your overall lifespan. The benefits are immediate and long-lasting. There are many resources available, including nicotine replacement therapy, medications, and support groups to help you quit. Beyond smoking, it is vital to avoid secondhand smoke. Being around people who smoke can significantly increase your risk of developing COPD over time. It is also important to minimize your exposure to other lung irritants, such as air pollution and workplace dusts and chemicals. If you work in a dusty or chemical-heavy environment, be sure to use all recommended protective equipment, such as masks and respirators. Staying informed about local air quality reports and staying indoors on days with high pollution levels is a simple, effective way to reduce your exposure. For people who already have a diagnosis of COPD, secondary prevention focuses on slowing the progression of the disease and preventing flare-ups. A critical part of this is getting your vaccinations. The annual flu shot and the pneumococcal vaccines are vital for people with COPD to prevent infections that could lead to a severe exacerbation and further lung damage. There are 2 types of pneumococcal vaccines, and your doctor can recommend which one is right for you. It's also important to practice good hand hygiene to avoid picking up germs. Exacerbations. A major and often frightening part of living with COPD is the risk of an exacerbation, or a flare-up. An exacerbation is an acute and sustained worsening of your respiratory symptoms beyond what you experience on a daily basis. This can be a significant increase in your shortness of breath, a more frequent or severe cough, and a change in the color or amount of your mucus. These flare-ups can be triggered by a respiratory infection, like a cold or the flu, or by an increase in air pollution. They can last for several days or even weeks and can be very dangerous. Recognizing the signs of an exacerbation early is critical. If your symptoms are significantly worse than your normal day-to-day breathing, or if you develop a fever, it is important to contact your doctor immediately. They may prescribe a short course of oral corticosteroids or antibiotics to help get your symptoms under control. Some exacerbations can be so severe that they require a trip to the emergency room or a hospital stay. Each exacerbation can cause a further, irreversible decline in lung function, making each subsequent flare-up more dangerous. Studies show that approximately 10 to 30% of severe exacerbations result in death. Proactive management and having a clear action plan with your doctor are essential to minimize their impact. A lot of people believe there is nothing that can be done about breathing problems, but there is always hope for treatment and management, including during these flare-ups. Treatment options. While there is no cure for COPD, there are many effective treatments that can help manage symptoms, reduce flare-ups, and improve quality of life. The most common treatments for COPD are medications, which are often delivered directly to the lungs through an inhaler. Bronchodilators are the cornerstone of this treatment. They work by relaxing the muscles around the airways, helping to open them up and make breathing easier. There are two main types. Short-acting bronchodilators, like albuterol, provide quick relief during a sudden flare-up of symptoms and usually last for several hours. Long-acting bronchodilators, Labes and Lamas, such as salmeterol or tiotropium, are used daily to keep airways open for an extended period, often for 12 to 24 hours. For many people with COPD, inhaled corticosteroids are also prescribed. These medications reduce inflammation in the airways, which can help prevent flare-ups. Corticosteroids are typically used in combination with a long-acting bronchodilator in a single inhaler for people with moderate to severe COPD and a history of frequent exacerbations. This combination approach often provides the best results. For people with severe COPD who have low oxygen levels in their blood, oxygen therapy becomes a vital part of treatment. This involves using a device to deliver supplemental oxygen, which helps reduce shortness of breath, decreases strain on the heart, and can improve sleep and overall energy levels. It can be used 24 hours a day, or just for certain activities, depending on the person's needs. Studies have shown that for people with low oxygen levels, oxygen therapy can significantly improve their lifespan and quality of life. A crucial and often life-changing part of treatment is pulmonary rehabilitation. This is a comprehensive program that involves much more than just exercise. It is a multidisciplinary approach that includes exercise training, disease management education, nutritional counseling, and psychological support. The exercise portion is carefully supervised to help people strengthen their breathing and other muscles safely, without causing excessive shortness of breath. The education component teaches people about their disease and how to manage it, which gives them a sense of control. This type of program has been shown to dramatically improve quality of life, reduce symptoms, and decrease hospitalizations by as much as 30%. For a small number of people with very severe COPD, surgical options may be considered. Lung volume reduction surgery involves removing small damaged portions of the lung so that the remaining, healthier lung tissue and diaphragm can work more efficiently. This can improve breathing and exercise tolerance in some people with emphysema. Another option for the most severe cases is a lung transplant. This is a major operation with significant risks, and a person must meet very strict criteria to be a candidate. Lifestyle and diet. Managing COPD goes far beyond taking medication. Making specific, consistent changes to your daily life can make a huge difference in how you feel and in the progression of the disease. The most important lifestyle change is to avoid lung irritants. This includes not only smoking, but also avoiding secondhand smoke, chemical fumes, and heavy air pollution. If you live in an area with poor air quality, check local forecasts and stay indoors on bad air days. Using an air purifier in your home can also be beneficial. Regular physical activity is critical, even though it may seem counterintuitive to exercise when you are short of breath. Exercise strengthens the muscles used for breathing and improves your overall endurance. Simple things, like walking for 20 minutes a day, can have a big impact. Your doctor or a pulmonary rehabilitation specialist can help you create a safe and effective exercise plan. Many people find that simple activities like walking, cycling, or even chair exercises are very helpful. Your diet also plays a significant role. Breathing itself requires a lot of energy, so eating a healthy, balanced diet provides the fuel you need. Small, frequent meals are often easier to manage than 3 large ones, as a full stomach can put pressure on your diaphragm and make breathing more difficult. Avoid foods that cause gas and bloating. Staying well hydrated by drinking plenty of water helps thin mucus, making it easier to cough up. Impact on lifestyle and lifespan. Receiving a diagnosis of COPD can be a difficult moment, as it is a chronic illness that changes the way you live. It is natural to feel worried, but it is important to remember that a diagnosis is the first step toward regaining control. The symptoms of COPD, particularly shortness of breath and fatigue, can have a profound impact on your lifestyle. You might find yourself having to give up hobbies you once loved, like gardening or hiking. Social activities can become a challenge if they require a lot of walking, or if you feel self-conscious about coughing or using oxygen. This can lead to feelings of isolation, anxiety, and depression. It is very important to communicate with your doctor and family about these feelings. Joining a support group, either online or in person, can also be incredibly helpful. You are not alone, and many people have learned to manage their condition and still live full, happy lives. When we talk about the lifespan impact of COPD, it's important to have a clear and realistic perspective. COPD is a serious disease that can shorten a person's life. But the extent of this impact depends heavily on the stage of the disease, whether the person continues to smoke, and how well they adhere to their treatment plan. For example, a person with a mild form of COPD who quits smoking can have a nearly normal life expectancy. A person with severe COPD will have a shorter lifespan, but with proper medical management, pulmonary rehabilitation, and lifestyle changes, they can still live for many years with a good quality of life. The goal is not just to extend life, but to make every day as comfortable and fulfilling as possible. The key message is one of hope and empowerment. While the disease is a challenge, it is one that can be managed. If you enjoyed this video, you will probably also like this one. Please subscribe to this channel and let us know in the comments your thoughts. Thanks for watching.